Hi everybody, welcome to Nazar Circus. How is everybody doing? I am fine. It's a miserable London day, but we're here. So I'm excited. I have a guest here. This guest has known me since I was 11. No, 12. I think I was 12. So I'll let you introduce yourself and I'll tell them how I know you. Okay, fine, lady. Can you tell us your name, what you do, and everything about you?
Hello everyone, good evening. My name is Nkechi. I studied medicine in the University of Ibadan and I work as a psychiatrist here in the UK.
Woohoo! Guys, so this is, I'm not going to call her Nkechi because I call her Senior Nkechi. So if you know me well, you know who she is. She was my school mother in secondary school in Queen's College. Big up Queen's College.
Big up.
Yes. And so we've remained close. And today she's here because we want to talk about something very important within the Black community, and that is mental health, which is your field. We are freestyling. We don't script anything. So guys, just flow with us. So I'm going to ask you a few questions and then we'll see how we go. Yeah?
Okay, I'll try.
Okay, so my first question is, why is there a stigma within the Black community when it comes to mental health? Why? What is it that makes us hide when we have mental health issues rather than seek help?
I think there's so many ways you can look at it. I think the one that stands out for me is weakness.
Weakness of the person that has a mental health issue.
Yes, they go, oh, you're not strong enough. Because Black is strong, Black is powerful. So, oh, he's weak, she's weak. You know? Because you hear the normal thing when someone says they're feeling low, it's like, snap out of it. It's the big deal. You've got everything. So snap out of it. Yeah.
So you think do you think it's like a cultural thing? Is that what you're saying?
What's our culture? We're strong, we're powerful, we're resilient.
Yes. Yeah. So the Nigerian. So we're breaking it down
let's go to Nigeria.
Let's go to Nigeria. Let's take it back to Nigeria. So you're saying our culture, you're supposed to be strong, figure it out, pick yourself up, dust yourself. You understand? Stop whinging, stop whining.
People are suffering here. What are you?
You're in the abroad. Yeah, you're coming to say you have.
Your father has money. You went to this school. If you're living in Ajegole, what would you say?
True.
Bridge, what would you say?
True. You have water. You have light.
Everything.
Yeah. So that's a big thing. So our culture makes us, even though we're out here. Do you know what I've realized, Nkechi? Senior Nkechi? I've realized that although we're out here, we really are still back home. We just live in a different location. Because many of us still have that mindset, like what you've just said now. Okay. So our culture has planted in us, instilled in us that we must be strong. And
boys don't cry.
Okay, boys don't cry. Boys can have, So our culture is one thing.
Let me give you another one. You're in pain. And someone says to you, and you're crying. Why are you crying? Stop crying. My father died. Stop crying now.
Yeah.
They don't mean that you shouldn't cry.
Yes.
I think it's very uncomfortable for people to see other people in pain or crying.
Yeah. They want it to stop.
They want it to stop. Say, stop crying. Stop crying. Stop crying is not a good thing to do. And then it's like, why should I?
So it's a lot to do with our culture. What about religion? Do you think religion plays?
There's a lot of things. Let's not talk about the religion. Let me just digress. I had a patient yesterday. He came with his partner of 18 years, another man, and he was raised Christian. He's from Australia. This guy has been suffering for a few years now. He's tried to end his life, he's done all sorts of things, had therapy, so. And then he came because the medications that he was taking weren't working for him. And then after speaking for a while, I said to him, this, that. Medication is not working for you because you don't need medication. You need more psychological stuff. I talk in therapy. And he now said, And then he got to a point he started crying because he had some trauma.
Mm.
And he's never told his partner about the trauma. And this thing happened not too long ago, about 5 years ago. And then he broke down and said he only ever spoke to it to a therapist that he had last year. They had gotten attached to. And I said, I don't want to go into the trauma because that's not my job. Because I can unpack those things and pack them back. So he now said he's going to tell me something he went through. He went for conversion therapy. And he said conversion therapy as in to not be homosexual.
Not to be, to be straight.
3 times in the church. You know? And then his basic thing was feeling rejected, feeling unworthy. He was made to feel like an abomination, like an aberration, like a stain, a most evil thing that even Satan will spit on him, is what he was taught in church. He was made to feel like nothing, you know? The most horrible thing ever, you know? And then I think his guilt about himself going through that, putting himself through that. His partner wasn't aware, you know? He wanted to change himself. He wasn't accepting of who he is. Yeah. You know? So that's his main guilt, and that's what we arrived at, you know? That was now causing a lot of things. You know? So that was really, really sad and very painful to watch. Poor man, lovely guy, you know? So religion does play a part as
religion
well.
Plays yeah. So religion would also be one of the reasons why our people do not seek professional. Yes, because we're talking about professional help now. I'm talking about professional help. That would also be one of the reasons why people do not seek professional help, because they believe they can pray it away.
They can pray it away. It's a huge, huge part. Even amongst the clinicians, I've worked with nurses, healthcare assistants, Nigerian people.
Who that are going through.
Dr. Fiele, that is, leave it alone. They go to church. They don't go and do deliverance. They're doing them from the village. I'm talking about people that are educated.
And they're educated.
I've had nurses tell me, Doctor, leave that matter. You know, I don't talk about the other African
nations, Niger, yes.
Doctor, leave that matter. It's spiritual. If
they pray about it. And
there's this girl I worked with many years ago when I was working in Harrow. Her mother died. Her father's best friend and like an uncle used to come to the house, you know, like for the support, you know, to support his friend. And, you know, they would have people coming to check on the kids. Her father was at work one day and this uncle came and he sexually molested her. And it wasn't just that one time. And then she told her father, 2 years later when she was 13, told her father. As at the time I was talking to her dad was in his 17th year in prison. He killed the mother. Okay, he killed his friend. He killed the guy, you know? But that thing messed her up.
Of course.
Because the guilt, she had PTSD. She would have flashbacks. She would wake up at night screaming, you know, the horror of what happened to her. And what did people around her do? They took her to church for deliverance. So she now she started hearing voices, and she would have visual hallucinations. She'd be seeing those African church people, because they took her to an African church.
Who knows? Yeah.
And they're speaking funny languages, and they would just pour water on her, making her stay in a room, and she would just be there. They'll pour water and give her very little white food, custard, or they'll give her milk or eggs without the yolk. Funny things.
To cleanse her. What you're just saying to me, just as you were just talking, I was thinking about how many people back home, and even people that we know, I'm sure, who were sexually abused by all these so-called uncles and aunties back home, and obviously they can't tell anybody. And as they're growing up, it's because they haven't sought help because we just don't seek help. So this thing about mental health, like you said, there's so many, it could be so many. Yeah, it could be so many.
One is raped, sexually abused. She can't say anything. Why? Because she'll be made to feel like she brought it on herself. Even amongst in the Western world, the woman is sexually assaulted. You caused it.
Talk less of back home. Yeah. So another thing I was thinking was the effect of domestic abuse on people's mental, because I'm thinking about so many. This are people, are Nigerian people, because the things that we go through that we don't deal with are plenty. What do you think, or in your opinion, what effect does domestic abuse have on somebody's mental health? So we're talking about physical abuse.
A child who witnesses domestic violence between
the parents, yes.
What does that do to the child? You know, the people always talk about there's a thin line between love and hate. There's a thin line between sanity and insanity.
Yeah, you can cross over.
Yeah. When you look at, there's a group of disorders known as personality disorders. Yeah. So they define it as pervasive things that happen from childhood, right? That form your personality. Yeah. And then people now adopt maladaptive ways of coping with that thing, whatever it is that they were exposed to as kids. There's neglect, there's emotional abuse, there's witnessing abuse, there's actually being physically or sexually abused as well as a child. Then you grow up with all those horrors in your head. You're not allowed to speak. Shh, shh, shh.
Yeah.
What do we say in Nigeria? Children are meant to be seen, not heard.
Yeah, come on, shush.
You know? And then the adult who is abusing a child says to the child, if you tell anybody, I will kill you. You know, there's so many reasons why people just stay quiet.
Yeah, mute.
And then the people who made the mistake of talking to an older person and say, look at what uncle did to me. Shh, don't tell anybody. And then we have the women who do not want to believe that their husbands will do those things and blame them.
As we're seeing playing out in the news, by the way. Talk about Niger.
All sorts of things. There's so many reasons why people now react differently. They either become closed off or they become truants. So
those children that have been in a home where there's been domestic abuse between their parents, right?
There's so many reasons. There's so many ways they react. Some of them withdraw. Some of them now withdraw into their heads and, you know, become like eccentric in a way. So people now make up stories in their heads. And they now have this narrative that they believe in. And they now live out that narrative. They have people who feel that they caused these things. They brought it on themselves. They start to punish themselves by either depriving themselves of food, self-harming.
That's a big one, yeah.
But the thing is, the self-harming that goes on in our country is different. People don't usually self-harm like we see here when people hurt themselves. You know, they probably would now turn to drugs, engage in
very dangerous behavior.
Things,
yes.
Like almost reckless, because they don't feel that life is worth anything. What is it? You know, you've done somebody I trusted did this to me. So what am I? I'm nothing. You know, there's so many reactions
to being that's for children. And for adults, in abusive relationships, how does that?
Gosh, where do I start from? I just spoke about this man. He's 53 years old. So 5 years ago, he was 48. He went through that trauma. So this is somebody who's been living with a man, having to deal with his own religious guilt, his own guilt about doing what is not meant to be done because it's in the Bible, right? A Bible written by men, dare I say. And he's going there feeling bad, feeling guilty, but still living that life, you know? And they went through what he went through. And that just broke him. So I usually use bones, like a fractured bone. It's almost like your brain has suffered an injury. Do you understand? And the problem with mental health, because it's not tangible, you can't see it. You know? If you saw somebody limping or walking with a stick,
you will try and even hold their hand and cross the road, yes.
But because you can't see this injury, this pain that they're talking about, you're like, it's uncomfortable for you. Do you understand?
Yeah.
And then they do not know most of the time how to express this pain, you know? And you know when they tell a child, use your words, right? Speak about it. So in this this new generation of kids, our kids are very expressive.
Oh yeah.
You are not meant to say
Yeah.
anything. I'm not for you. Keep quiet. Manage yourself. You wear tight shoe. Wear that shoe like that.
Figure just be manage it.
Yes,
Yeah.
manage yourself.
So I think that, and Nkechi, it's funny that you say this because really, you're right. I think the buck is going to stop with our generation. This buck of the stigma, because I know the younger generation, you hear about, sometimes we even mock them and say you people are wrapped in cotton wool because any small thing, everybody is depressed, everybody is on medication or whatever. But at least they're speaking out, they're getting help. Our own generation, we're not. And this brings me to somebody I was talking to, and we're talking about mental health, and I said, she admits that she has depression, but she said to me, but I don't have mental health issues.
Oh, really?
I said, but wait. I wasn't laughing though at the time. But I said to her, but you do know depression is
classified.
You do know it's a mental health issue. And she really struggled, and obviously it's a Niger person. So we're still back to this stigma.
What do you mean by depression though?
I said, she was feeling low, she was prescribed medication, but now she doesn't take it anymore.
Okay, to ask you a question. Somebody faces something terrible, like grief. I lost my dad last year.
Yeah.
I was low, very low. And the only thing that kept me going was work and my children. You know, trying to put up a face. I'll come back from work and I don't want to talk to anybody. Curtains are drawn, I'm just sitting in the dark, you know?
In your own space.
But I knew what was going on. It was the grief. It was so many things. The guilt. I'm a doctor. What could I have done different? Should I have done this? Should I not have done that? So I dealt with all of those things. But I had one of my colleagues at work, a clinical psychologist, who I had informal chats with. And she helped me identify my emotions, what I was feeling, and name them. Do you understand? And as much as I knew that I had the memories, it's one thing to be philosophical or to come up with your own ideas, but when it happens to you, it's different. But I knew that what I was facing wasn't a chemical imbalance. It wasn't a chemical imbalance. It was a situational thing, right? Now, a lot of people have situational depression based on circumstances that have happened to them, right? Some of those people can react to this extreme level where they end up hurting themselves. You remember during the recession, we had a lot of people flying out
yes,
of money.
Yes.
You know, that was immediate. It wasn't like they had long-standing mental health issues. And then of course they were facing the prospect of embarrassment.
Yes.
What people say, I've messed up, let me kill myself.
Yeah,
you know,
I can't be here.
Face it,
Yeah.
So, but then the depression that people use loosely, it's not the depression that we talk about. Like the guy I told you about, he wasn't clinically depressed. So that's why when he tried all manner of antidepressants, he even went to the highest one that we usually use for people that have almost like you want to say treatment resistant depression, and it didn't work for him. If anything, it had the opposite effect. And I said to him, you don't have a chemical imbalance. What you have is a psychological issue that needs to be addressed, you know? And psychology, people think psychology is this magic wand. You go and talk to a psychologist, everything is fine. No, it's like going to the gym. You know, you want to go from 100 kilos to 70 kilos and have a toned body, you're going to have to work for it. You go to the gym, you have to do a lot of assignments, cut out this, cut out that. Is hard work. So I tell people, going to the gym needs muscle. This one, you have to have muscle of the head, mind. To
be able to.
It's hard work.
Do you know, it's so good that you explained this. Yes.
Your friend, if she was clinically depressed,
she won't be saying, But it's good that you even, I'm glad that we're having this conversation because, and that's why ignorance, when people say ignorance is bliss, I disagree. I do not like to, I like to know. Because now that you've actually said it, I've now realized that we use, let me speak for myself. We use depression. I didn't even know about the chemical imbalance and situation. To me, if you're feeling low over a period and you can't come out of your rut, that's how in my head I saw depression. But you're saying it could be an imbalance, and it could be you're going through a difficult time and you're just low because you're going through a difficult time, and hopefully eventually. But both of them need medication, right? Both of this is okay. Okay.
So, if you have you can always call it like acute stress reaction.
Okay.
You have this
Yes.
stressful thing, and you react in this way. You're very low. You're apathetic. You don't want to eat. Or you can't sleep, or you can sleep, or you overeat. There's a typical depression. You know, there's so many levels of depression: mild, moderate, and severe. Right? Severe depression would probably need some form of chemicals, like to give you lift your serotonin levels, right? To lift your mood to a certain degree where you can now engage meaningfully in some talking therapy to help you understand why you're feeling the way you're feeling, and probably just equip you with skills that you can use to cope with situations, right? But then you're not usually on that medication for that long. Take a woman who's had a baby, has postnatal depression. That doesn't necessarily mean that she'll have depression for the rest of her life. You know? So usually in the first few months of pregnancy is picked up early and is treated and dealt with medically with medicines and talking therapy. They usually might not need to. They might not necessarily have it again. You know? So that's an acute stress reaction. Pregnancy that's another big matter for us. Right? So there's that. There's the acute stress reaction, acute. When it's not addressed, it can go into a chronic issue, right? And it now becomes something. We have depression that now progresses to psychosis.
Psychosis, we'll be saying you're now on another. So if left unaddressed.
Yes, if left unaddressed. And that's the thing, you know? But because now, what does psychology do? I talked about equipping you with skills, right? Coping strategies. What do we have as coping strategies back home? Shut up there. Behave yourself. You know? If I sound you.
Your brain, you'll reset your brain.
We have people in this place, in this country, these people with personality disorders, right? Emotionally unstable personality disorders. They cannot regulate their emotions. They were not taught to regulate their emotions from when they were kids. You know? They're going from this to that. You know, and the thing is, people will say that they're throwing tantrums or they're seeking attention, you know, but they're trying to express what's going on in them. So they haven't learned how to regulate their emotions, and they do those funny things. They have low moods, you know. Sometimes antidepressants can help them, but they're usually not treated with medication on a long-term basis. You know, even though some people just stay on medication for the rest of their life, and then they do a lot of therapy. You know, what do they learn in therapy? How to cope. How to identify, how to avoid. Do you understand? So you know that this thing could possibly trigger you. You know, before you get to that stage, what can you do? How can you bring yourself back to the present? Sorry, you know. But back home, a conch from your mother will reset your brain for you. You understand? And you keep quiet and you learn to cope. There's a lot of us have ADHD, right?
Yeah.
ADHD, and you learn how to behave yourself, because you cannot have ADHD and be playing in class. By the time your teacher slaps you
or flogs you, and then your mom will now flog you some more. Exactly. Or if your parents are
what did you do? Yeah, come on. So you learn how to hold yourself in class.
But does that then mean? Let me throw a spanner in the works now.
Yeah,
if we were able to back home, if we were raised back home, if we were able to kind of manage it. Manage it or get by basically without medication or whatever. Why is that not the case here?
Exactly. Now, let me give you one patient I met today, because I like to use real life situations. I met this young lady that came in this morning, and she has traits, ADHD traits. She also has this emotionally unstable personality where she cannot regulate her emotions and all that. And she went for an assessment, and the guy had prejudged her based on her diagnosis of emotionally unstable personality disorder, her use of cannabis, right? And now did not give her that diagnosis. And I said to her, the only reason why I would advise an adult who is diagnosed in adulthood with ADHD, the reason why I give you medication is because you're not able to function. You know, because as usual, the mainstay of disorders, not illnesses, is usually psychological therapy to learn how to manage your issues.
Yeah, whatever it is. Yeah.
So you learn how to anchor. You learn how to ground yourself. Right? You don't necessarily need medication. Do you understand?
If you're, yeah, okay.
Yeah.
I see what you're saying.
Yeah.
So those things.
So I believe I have ADHD. You know, based on a lot of things. I've not gone for a formal assessment. I've not gone for formal assessment. Even if I'm formally assessed as ADHD,
You're still not gonna. Yeah.
I'm not going to change anything.
Yeah.
I know why I'm where I was before. But I'm grateful for the boundaries that we had. You know, we had structure. We had lines we had to follow. You know, you do this, you will do this. Consequences and all of those things. Here, we have no consequences to our actions.
Yeah.
You know, we just get away with lots of stuff. And then we now learn, we create a narrative. It's because of this. You don't take accountability or responsibility for anything.
Yeah.
They said it's because of this. You know? But at the end of the day, as I said, the only reason why you take medication is because you're not able to function.
Yeah.
You're able to calm things down to a point where you're able to concentrate and focus on work, for instance. You know, so I know people who are unable to function somewhat.
Yeah.
And when they've gotten some medication, they're like, oh, things are easier for me now. You know, that's viable, and that's something that can be done. You know? But not all diagnoses need medication.
Yeah.
Yeah. For disorders, if you have an illness, it's a different matter. Now let's use physical symptom like headache. You have a headache. Why do you have a headache? When you say you have a headache, what do? Take paracetamol. And then so what? What is causing your headache? Are you dehydrated? Have you had enough sleep? Are you stressed out?
Are your eyes putting a strain?
Exactly. You know, remove the causes. You might not need medication.
True.
Avoid those things. You might not need medication. You know, but the first thing we do is medicine. Boom. That's what we're going to do. You know, I prescribe medication. I'm not against medication if it's needed. You know, but if we get to the root cause of a lot of things, we can understand why and try to avoid those things or come to terms with those things and manage what those things are causing us. You know, I'm talking now in mental health.
Yes. Yeah.
So, but if you have a chemical imbalance, and that's the thing about psychiatry, there's a lot of chemical imbalances. You know, mainly serotonin and dopamine. So the psychotic people, it's not village people that cause them. You know, it's there.
So some of that is drug induced, right? People that take drugs.
Oh, how are you reading my mind?
Yeah.
There's drug induced psychosis. There's a strong hereditary thing in mental health. So yeah, illnesses like bipolar, schizophrenia, you know, yes, there's usually a family history.
Really?
Yeah, something that yes, there's some genetic stuff going on with those illnesses. I didn't say disorders.
Yeah.
Do you understand? There's a big difference, you know.
Please tell me again. So illnesses. Tell me that.
That's my own.
That's your own. Yeah, but it's a good way of because me, I had to retain it. That's the way I'll understand it. So illnesses, so psychosis is an illness,
yes.
And that requires
due to chemical imbalances.
Okay.
And then going back to drugs, right? Drug-induced psychosis, right? People start taking drugs very early on in your teenage years, right? And what's going on when you're still growing, your brain is still forming. You're not taking chemicals that will mess around with the chemicals of the brain.
Okay.
Right? And then some people say, I've been smoking it since I was a kid. You know, nothing happened to me. Why? It can't be the drugs I'm using. It's something else that is doing me. Hello? You mess you know?
Hello?
Your brain, you destabilize the balance. You know? So you have dopamine shooting up here. You know, you have serotonin going here. And you know, in schizophrenia, they have what they call the negative symptoms.
Okay.
So not everybody with schizophrenia necessarily has the positive ones that people can, you know, they're hearing voices.
Okay.
You can have negative symptoms of schizophrenia like depression. You know, they just isolate themselves and they're very paranoid.
Okay.
You know.
So that's so two extremes. So the drugs causes is imbalance. That's
imbalance, You've got those those cells are like dancing here.
They're all over the place.
All over the place.
Yeah.
All over the place. To the point of you hearing voices. You know. Now we have people who have personality disorders, right? They get to such high levels of emotional intensity, right? They're like, they go from 0 to 100 just like that. Sometimes without an obvious trigger, you know. But a lot of the times it's usually situational, you know, relationships,
something,
you know, their own ideas, their own insecurities, you know. I look at you and I smile. You interpret my smile to be, I'm looking down on you. I'm laughing at you. You react in a funny way. You come and ask me a question. I'm like, sorry, let me sort this thing out. You feel like I've rejected you. Your brain now starts to work, you know.
Escalate to some trigger, to something else.
Where you now have what we call pseudo hallucinations. They start to hear voices, but those voices are just their own thoughts that become so loud in their heads, they can hear them as voices. You know?
Oh.
Yes. So you have people with personality disorders, right? And they say they can hear voices. And then you have some clinicians giving them diagnosis of schizophrenia or bipolar affective disorder or psychotic depression or transient psychotic reaction. That's absolute rubbish. You need to dig deeper. But we don't have enough time.
Hey.
You know? We don't have enough time. So you go to the GP, your GP thinks, oh, you hear a voice.
Take. Yeah.
Another issue. When they see mental health,
go.
And give them medication. They'll go.
Yeah, I even know so many of the medications just by my clients saying, I'm on this, I'm on this, I'm on this. And I'm like, okay.
Yeah. So a lot of them just give them medications and they go away with them. They now get referred to mental health services. Some people don't bother. They just look at what they've sent you for and say, oh, psychosis. And you just continue the narrative, you know? And then I have destabilized a lot of people.
By looking in.
I've changed a lot of people's diagnosis. No, you cannot wake up at the age of 40 and have psychosis. What caused it? You know? What happened? 2 years ago when I was working in Brighton, I met a few women, you know? And I think maybe because it helps being a woman and understanding our hormonal issues. That's another thing. You know? PMS is a thing.
Yes, absolutely.
Guys say, oh, women are just... PMS is a thing. PMDD is another thing. Right? So premenstrual syndrome is one. PMDD is the senior brother.
Oh, there was a program I watched and the girl had PMDD and she kept saying, I've got PMDD, I've got PMDD. I love, it's not one of these love at first sight or one of these things.
Yeah, married at first sight.
Yeah, married at first. She kept saying I had PMDD. I was like, what the heck is PMDD?
PMDD is premenstrual dysphoric disorder.
Okay.
Your mood.
We'll just,
disorder.
Okay.
And they drop to sort
low.
Yes, you know. And so this lovely girl I met in September of 23. Yeah, 23. So she had a diagnosis of bipolar affective disorder. I read through her notes. When she came in, I was like, this doesn't make sense. And I think because of I'm quite anal and I'm too inquisitive. And I started asking her questions. So I said to her, you know something, do me a favor. There's some things I'm not quite clear about. You cannot have a diagnosis of bipolar and you're just on this tiny dose quetiapine, 25 milligrams. That's a starting dose, and they usually give it for calming people down for anxiety and for sleep sometimes. You know, if you have thoughts that just don't make it easy for you to rest. And I said, I'm not saying you don't have it. I just need more information. I need more time. So it's going to be an ongoing assessment. I don't even assess and diagnose, but this is for me. I'm calling it an ongoing assessment. So I need you to go, and I want you to start a mood diary. Right. In the meantime, I'm going to ask your GP to do some blood tests for you. I need your hormone profile, female hormone profile. So this was September. Then, because I knew that I wouldn't get too much in a month, I said, I'll see you in 2 months' time. So I saw her in November. And the GP has started her on the oral contraceptive. You know, HRT is estrogen and progesterone. So she was on this contraceptive pill. Right? And she started it. And then we looked at her mood diary. I told her to track her mood with her period. Because you cannot have bipolar and it's only happening at a particular time of the month.
Selective bipolar.
Exactly. You know? So we now realized that it was to do with her period. You know? But her blood test confirmed that she had those hormonal disturbances. GP put her on the hormone pill and the contraceptive. So I now gave her a mood stabilizer, right? and it's quite effective for PMDD. So I put on the mood stabilizer. I'm not going to go beyond a certain dose, you know. It might just help you, you know. And for all it's worth, take baby Primrose oil. That's not medical. There's no scientific backing, but I've used it all my life, and I encourage my daughters as well. So, and I gave an appointment in January last year. So I remember it was not too long before I traveled to Nigeria. I came out, they sent me a message to say my patient had come, and my 10 o'clock had come. So I walked out of my office, went to the reception, saw this lady, nodded at her, I looked around, and I went to the reception and said, "Where's my patient?" So that's her. I looked at the girl. I said, "Please come."
It was the same girl.
She said, first of all, just even understanding that her hormones were causing her issue, that was a big thing for her. To now accept, oh, this is the
what is causing this thing.
Exactly. There's nothing wrong with me. Because when you now start worrying about what's wrong with you, you know, because
that's another worry.
That's another worry. And takes you to some to some dark places, you know? And then that was it.
So that means a lot of women that people are saying they have tico. If we actually, including myself, maybe if I check, I'll see that.
I used to joke that my mother was always angry when we were kids. You know, I was born in Pekin every year.
Yeah.
Do you understand?
Yeah.
You're dropping, and she was a nurse. She was working.
Hormones are not even settling.
That's the one young girl. I met 2 women who had menopause-induced psychosis. One of them divorced her husband. She was on Facebook one day, saw this guy who she knew in secondary school, and it just entered her brain that the guy was coming for her. They were going to get married. And she was in a relationship with the guy. She's never spoken to him before. Didn't have his number, nothing. But she was waiting for him to
marry her.
She divorced her husband.
For the guy?
Yeah. They said she had psychotic episode. Yeah, she had a psychotic episode, but why? When I looked at this woman's nose, I said, she only came into contact with mental health services in 2023.
So,
and the same 1970, you know? I said, can you be 53
and now all of a sudden go crazy. Yeah.
So when she came, I said, okay. She was telling me she wanted to reduce her medication. So I said, wait, first of all, let's unpack it. She used to get periods. She said, no, she doesn't have them regularly anymore. I think the last period was like 3 months before or something. I said, do you have night sweats? She said, man, you know, night sweats, her mood swings, everything. Body's itching, hair is dropping off. You know, she's gaining weight. She cannot do anything. She's lost her motivation. Her mood is this, that. I said, okay. I'm just going to tell your GP to do something for me. Just put you on hormone replacement. Do your blood test and do hormone replacement. I saw this one 6 weeks later. Different. So I went there off her medication. She just needed hormone replacement.
I think that hormone replacement, I need to look into it because all these things, the body itching that you're talking about. Yeah. Can you see that brush there? That's what I used to. I have a toothbrush that I used to scratch my back.
No. Are you serious?
Yeah. My body itching is so.
But then we have women now. Let's go back to Nigeria.
Yes.
So a woman is going through the menopause, right? And she doesn't know what it is. She'll just say, okay, the weather is not good, it's hot, AC is not working, NEPA is taking lights, you know? So back then, we're not educated about stuff.
Of course.
And even if we're going through the menopause, a lot of women saw that as a change. Rather than welcome it, they dreaded it. That meant they were no longer who they were meant to be, right? And then that will not start affecting you. Your self-confidence drops. You're gaining weight, you have no motivation to do anything again. And what did they say? You're an old woman, they just put you in one corner.
And that's it, it's all over.
Nigeria,
yeah.
You know?
It's all over.
It's over, yeah. And people didn't talk about it. The same, even now, people do not talk about stuff.
No.
You know? A friend of mine was diagnosed with cancer before he turned 50. Years before. He was monitoring, right? And then the year before his 50th, the doctor said, we have to take this thing out, you know? And he was like, I'm never going to do my party now. Because he didn't want them to do surgery and then he not standing. I said, be a dead man walking. and he did this thing. And I said, oh boy, I don't know about you. I'm going to tell everybody that coming, that knows, everybody that knows you, that you better go and be checking your prostate.
Yeah.
And he said, yes, please go ahead and do it.
Yeah.
Because, you can save somebody's life.
Our people don't. Our people just no. Because I did an episode on prostate cancer. I had two lovely guys volunteer, and it's still. And let me tell you, doing this podcast has just shown me how. And I say this, I think, on every episode, how conservative and secretive our people are. Yeah. I think Nigerians have got to be. I don't know about other cultures. We don't want to talk about anything.
We don't talk about anything.
Like this mental health, and that's what we're talking about, this mental health thing. Because so many people are going through things that they shouldn't even be going through.
Yeah.
And they will not talk to anybody.
No. Because somebody would have told them, don't say anything. You want people to think that you're crazy.
And it runs in our family.
Who's going to marry from our family?
If they know that if they go and go and do the inquiry, they see that there's tickle, that they see that there's tickle.
Yes, there's that as well.
So what would you say to a Nigerian? Let's talk about Nigerian. What would you say to a Nigerian who you suspect has something, has a mental, we don't know what it is, but you suspect there's something not right?
I can tell you stories. The phone calls I get, I have a family member, this, that. What can we do? What can we do? I'm like, there's medication you can take. I've done some for people before. But it's best to get somebody who's keeping an eye on you, So we have lots of people with mental health issues in our country.
In the UK. Yeah, we're talking about because the ones back home they're back home. I'm talking about the UK. In the UK here, I know me single-handed, and maybe I even have my own tico. So I'm talking about everybody has a level of tico.
But we don't have
chemical. The chemical one is different. But it's someone that like let's say I had a friend and I said to you, Nkechi, this is my friend, blah blah blah. What would be your first? What would you say? So talk me through what you would say to somebody who you feel has something. If I tell you that I have this friend
let's use your friend that you said she had depression. She was giving medication.
Yes. So if somebody, that one is already on medication. Let's say we know somebody together. We know that all is not well. Something is up.
Like the person we discussed earlier.
Yes.
That's the personality thing.
That's a personality. Yeah. Oh, now I remember. You're mean. Yeah. So if we know somebody and we know that something is, not right, what would you, as a mental health, as a psychiatrist, what are the stages? What would you say to the person?
Here in the country.
Yes.
You go first, primary care. Go to your GP. Right? Go to your GP. Your GP's job is to figure out if you need further input from mental health services.
Okay.
There's some things that GP can handle. Like depression, for instance. GP can handle depression, give you medication. There's some GPs that they're quite good, right? There's some GPs who are very old school. So these days now, for your GP training, you spend, I think it's 6 months now. Before they just do a rotation for like 3 months or something like that.
And that's
so they're doing 6 months in mental health. Yeah, because if you don't handle it properly here, it can become something else.
Yes. Yeah.
So the first place you should go is your GP. Don't go to your chemist. Don't go to your church. Don't go to your pastor as your only solution. Exactly. And generally, we have people going to church for healing. Even the pastor is traveling abroad, coming here to get treatment. But let's not even go into that one. So the first thing I'll say, please go to your GP. There's some people who have advised to go to their GPs, and I've told them, use these words. Will get your GP's attention. Because they have some things. They have to, yeah. So there's some keywords I'll tell you to give your GP. The GP should know that, look, this is serious. Like what? Like what? Give us expo. I don't want to give too many people. Okay, just give me one. Is it? I feel I feel like self-harming. No. Okay. Let's use depression. I don't find, nothing excites me anymore. Yeah. Okay. I don't see the point to living anymore. That's
okay. That's enough. Okay, so yeah.
I don't see the point to living anymore. There's no light at the end of the tunnel for me. I can't get out of bed. I don't have any motivation
for anything.
Yeah, I don't have any. I'm not interested in my partner. You know, so they have some classic symptoms of depression: loss of libido, apathy, lack of motivation, loss of interest in things that used to thrill you. Obviously, there's a low mood as well. You know, so those basic things. But when you now tell your GP that, sorry, I've had some scary thoughts about ending my life.
Yeah, that's true. Yeah, true.
I've had family members who have called to say that they know that the family member is not well. She's acting funny, she's doing this, she's doing that. And the person is not going to go to the GP. So I'll give you a case of a classmate of mine, you know, whose sister was going through some stuff, right? And she was saying some things that did not make sense. And almost like delusional and kind of paranoid. And there was this racial flavor to her delusions and what she was saying. But the things did not make sense. So they couldn't reach her anymore. So I said, okay, do you know anybody who lives in the area? You can call the police to carry out a
welfare check.
That's the first thing. You know, so GP cannot go because you cannot discuss with the GP because of confidentiality. So you can call. We have the crisis team. We have the mental health helpline. They can advise you. You know? So different areas.
So these are good. And it's good that we're discussing. These are time because these are things that are important. Yes. So one thing is going to the GP, but some people don't want to go to the GP. Some people are worried about all types of things. So you may not even have the insight to even get up to even go to the GP. So so that one is one thing. But you're saying as friends and family members, we can help them, those people that cannot by themselves go, by asking the police to do a welfare check, contacting the crisis team. So they're okay. Okay, so that would be the first thing. And me, I would say, don't tell your church members. I know they're going to come for me. But I feel like if you they'll start talking about the pastor, will start praying the thing away.
It's demonic attack. My question is, so demonic attack. How come the white people don't have demonic
attack? The demons are only back home. But I think it's really important that our people and our generation, like you said, and I'm not worried about our Gen Z. Our Gen Z are on top of things. In fact, to me, some of them over. You know, we talked about ignorance is bliss. Yes. But information is power. Yes.
Information can be dangerous.
Yeah.
There's too much information out there.
Yeah.
And I remember one time, it seemed like it was a fad. This was 2018, 2017. I saw a lot of young people in my clinic, and they were all talking about death.
Yeah.
Like it was almost like a glamorous thing to talk about.
I don't want to be here.
Yeah. There's nothing for me.
Yeah.
No, you're coming with the piercings and you're doing your nails and everything.
And you're I think there was a time that it was something. It was something. Self.
It was a lot of those things were learned behavior from a lot of people were copying other people. So you want to be like what they call them again, the emos. You know, there's be another than before the emos. Those black, all dressed in black.
What, goth?
The goth.
Yeah.
They're no longer called
the goth. Is that the new? Okay. Sorry, I'm not even with it.
I don't know what they call them now, but they were emos called emos a few years ago. So I'm not kind of flowing with the. So it's not almost like a thing to be dark and to be mysterious and to be thinking philosophically about
things,
the life after.
Because even the self-harming, a few people, some people would self-harm and take pictures and so that you could see the scars. I'm like, what is the younger people, obviously. I'm like, Like, what are you?
They'll post it on social
That's what I'm saying on social media now. I'm like, what are you trying to do?
Yeah.
So theirs is another. That one is another skill. Our own is not being able to say, and like we just talked about, there's so many things that could be causing us to have, but there's help out there.
Yeah,
and and I'm sure there's a link between this mental health thing and divorce rates, because things like menopause, like what you're saying, if you're going through menopause and you're acting like a lunatic, right, and you don't even know that that's what's happening to you, and people around you are being affected by your moods and whatever else, I'm sure relationships are broken down. If we think about, if there's a study, I'm sure. Why are you smiling?
No, because you know why? What I'm saying, the reason I'm smiling is because I had a talk a few months last year, and we were talking about menopause, and I said, are you guys aware that there's the male
of course.
They call it the midlife crisis. So I'm saying midlife crisis as just specific for men.
Yeah.
Women go through midlife crisis, but theirs is
yeah.
They go through that, but they don't express themselves. Right? What do? They're going through stuff. Their body is failing them, especially that their member.
The member, the organ.
The organ is not at attention before.
Yeah.
They wake up in the morning. It's not as rising towards the sun kind of thing, right? So, what do? They want to feel that excitement. They want to feel that thrill of being young again. You see them going to go and buy a Ferrari or motorcycle.
Doing one kind thing.
They will now find one small girl. Just to prove that it's not me, it's my wife.
It's
that old woman at home. And of course, the excitement of something.
It's real.
You buy is attracted to you. Everything. The excitement will be there, but you cannot sustain it. You know? So, you now start using things like Viagra. You use Viagra with your wife. You know? So that's just going through their own menopause.
Yeah.
But then people who do not talk about it. But you know the good thing about men. Men talk to each other.
Do they?
They talk to each other about certain things. Right? But not about the deeper things. You know? So you have a group of guys, and then one wants to prove to them, okay, I see them for you just see girls all over. Maybe nothing will happen.
Nothing.
You know? So that's how they talk to each other.
But they're not. Yeah, because I know, because I remember actually it was my brother who sent me something, and if I find it, I'll send it to you. It was a group of some friends who had gone through serious things, but it was so funny because they were trying to tell each other about what they'd gone through.
Without saying
but they kept it so light. Like I think, for example, one said, oh, yeah, Pops just passed last week. So I think my brother was trying to show me how guys are so different from women. Because I would call you and cry my eyes out for hours if that happened to me. But guys, they would keep it all surface and try and just minimize it. So
I have to be a man.
Yeah.
I have to man up. Do you watch Fuad and James?
No, I think that was is it a podcast?
Yes,
I think that's the one.
I love those boys.
I think that's the one.
Yeah, they've done some things that I've seen recently where they're talking about things. Things, you know?
I have to check my phone. I think are they American?
No, they're black boys.
No, this one's
Fuad is a Nigerian boy. He's black and
Shits and Gigs. Okay, no, yeah. Oh, my daughter watches them.
You know,
yeah.
I love when James. I think he wears his heart on his sleeves, right?
Which one is James?
It's a fat skin.
Okay, but the other one is that. Okay, yeah. Yeah, okay, yeah.
So they talk about things, right? Some deep things. I'm just like so touched by them. And there was something before I said something about the other day. I was talking to my therapist. You know?
Wow.
That's another thing these young people do. They're recognizing the need to talk to somebody.
Yeah.
To talk through certain things that they cannot talk about with other people.
Yeah.
Right? So he said about his therapist. I'm not sure if James has a therapist. It was Fuad that said,
really so impressed. Oh my God.
James will ask questions, deep things about like emotions and things.
So they really talk. I need to start listening to them because my daughter listens to them, but I don't.
Yeah, I was just thinking myself, this guy should do more things like this for men to say that it's okay
to actually
be vulnerable.
Yeah.
There's strength in being vulnerable.
I think that they would. I think that at that age they would do well, but the older generation I'm sorry. I think I've written off the older generation in terms of sharing anything.
Let me make you laugh. I'm sure you've seen this video. Tell your Nigerian brother that you love him.
And
say, I love you, brother. I'll see you later. I say, brother, I love you. What is this love you? You're telling me you're loving me. Do you understand?
Yeah.
So
we can't.
You can't even express that.
Yeah.
How can you not tell somebody you're going through something really dark?
No, we can. I'm telling you that this podcast has taught me to get. And I'm like you. I have loads of male friends.
Yeah.
They share everything with me.
Yeah, but they don't tell each other.
They will not tell each other. And I'm like, okay, can we do a podcast? We don't have to say your name. They just will not share. And
actually, I have a friend of mine. When I said to him that, I was going to see my school daughter and we're going to do a podcast on mental health, he said, why isn't he there? Exactly. But it's not. It's just like he has an opinion on everything. You know, he is one of my rocks. When I was going through a few years ago, he was one of my rocks. He was sunny. He pissed me off. Would fight. We fell out big time one time. You know, but he has an opinion, and it drives me nuts.
But it's good to have opinions.
Yeah.
You're better off having an opinion than being flat.
It's one thing to have an opinion, but that's an opinion. But not necessarily somebody else's fact.
Yeah, true.
This guy wants to make his opinion your fact. You know?
By force.
Oh my God.
By fire, by force.
Yeah, but
so he should set up something. Someone like that should set up something because he will get people talking.
If he was here, I don't think you'll let us talk.
Are you serious?
Oh my God. But he's really good. He's very insightful. He's very intelligent.
So maybe one day we'll bring him.
Maybe it'll be nice.
Maybe one day we'll bring him. Do you know, I've learned so much about mental health, about it's good to just talk.
How do we destigmatize mental health?
Yes, that is what I wanted to, within, not even in our country, within our community, because I feel like our country, unfortunately, we're out here, so I don't know how much impact we can have, but within our community, I have a question for you. Depression.
Yeah.
I struggle. I feel like I'm not equipped. If someone tells me that they're depressed, because some people will tell you, the ones that are not hiding it and don't deal with the whole nonsense stigma that people put on whatever. Depression, when someone is depressed, should they tell you the support that you should give them? Or do you understand?
It's helpful. Usually when I see people, especially those ones that self-harm, for instance, what are your triggers? Let people around you know the things that you find helpful. You know, if it means using a traffic light system, red, amber, green. When it's green, everything is all good. These are the things that I'm doing. When it's amber, I'm neither here. You know, anything can snap me. These are the things I would love for you to do. The kind of things I don't want to hear. So
they should help.
Yes. So it's always good to tell the people around you, your support network, your friends, your family, I'm going through this. This is what helps. This is not what helps.
So everybody knows.
Yes.
Yeah.
And then we like to help. Overzealous. We want to help. You know.
We may not be helping.
Yes, I think for us now, if someone says I'm not feeling too good, you can ask them why. You know, how can I help you? Don't say, don't worry about it, it'll be better.
Or let me come, or I'm coming to visit you. To come and talk, because the person may not even want to be talking to you.
Exactly.
So it's good to...
what's wrong with you? How can I help? First of all, how can I help?
That's very helpful. I think I like the how can I help, because then you're inviting the person. Because sometimes I'll have people tell me, and I'm just like, I'm a worry what? So instead of asking how can I help, I'll now start worrying. That I hope the person not gonna go and do something, or when I should have just said, how can I help you? Okay, that's good. That's good to know.
Don't say, don't be depressed, everything will be fine. How can I help? Because how can I help can help them to figure out what they want or what could help them. And it can lead, that conversation could lead to you saying, have you spoken to your GP?
Because they've opened it up, and then yeah.
Have you spoken to your GP? Or the ones that say, I've seen my GP has given me medication. Has it made a difference? Is it doing anything for you? And he's saying, no, it's not doing anything. Have you gone to see your GP about that? To
review it.
Review your medication. You know? Is that...
simple?
Yeah,
I think it's that simple, but I didn't think about it that way. Because it just would normally send me into like panic mode. Because when you don't know something, you don't know something. Yeah. So lastly, how do we destigmatize, or what roles can we play in destigmatizing? Well, I don't I'm not part of whatever. We, as in our community.
God bless you. The word community. Because what kind of community are we talking about? We have the church community and we have this local community, right? I think, as I say, charity begins at home. Where's our home? Church. All of us, most people, churches and mosques. I think, I don't know how we can start including religious leaders
in
not
things.
not just religious, not just churches. We have people as well in other religions that believe. So religion is a huge part. It's a huge stumbling block for a lot of people because they're not supposed to. They're supposed to believe in this, and some people feel like because they have sinned, that's why they're being punished. You know, and the only way to get better is to do penance and
go through the suffering.
Go to church, fast and pray, pay your tithe. Because you didn't pay people are not going to take advantage of you because you're so vulnerable and so desperate for help, so desperate to be saved, right? And to be absolved of the sin that you think,
which is
do anything, go to any length to get that thing cleaned up, you know. So I don't know how we can start educating our leaders.
I think it's educating,
and involving them
and making them accountable, and they should be held accountable for what they say to people. Yeah.
The flip side of the coin is if they're saying to people that you need to go and see a doctor, how then will they get people enslaved and paying tithes?
So it ain't gonna happen.
Well, we do have some good leaders, you know. Funny thing is, you've just given me an inspiration now, an idea to speak to one of my old friends. He's a doctor, he's a pastor. So he's a lovely human being, and he keeps it real, you know. He's not money. You know those people that he talks about real things, you know. I think one of his passions is family. Marriages, because they do a lot of marriage relations and everything. He's a lovely guy. He dances in his church. Our boys now, do you understand? But him and his wife are just an amazing couple. His birthday is in March, I think. A couple of maybe next week. I'm going to send him a message and ask him about his views on mental health.
Because Nkechi, thinking about this mental health thing, so many of my clients, because obviously I represent parents, so many African mothers, this mental health situation, it's far. We don't even understand how serious this thing is. Do you know how many children are in foster care because by the time social services even get involved, it's now reached another level where they've gone to the house. Children have not eaten, school, maybe the kids haven't come to school, then they can't reach the mom, then from there they now go to the house to go and do welfare check, come in, houses, everywhere is dark, children have not eaten. So this mental health thing is very serious out here. I don't know about back home you even see people, maybe people can even talk to you and
gosh, it just I have so many stories to tell you. So there was this lovely girl I met a few years back, actually 2 years ago, and she was meant to see another consultant, but that one wasn't around, so I now saw her, and she stopped taking medication because of one thing or the other. There was something a bit weird about the girl, the way she dressed, and she had this funny accent. I'm like, I looked at her surname, okay, and I said, where are you from? I'm from Brighton. No, you're not from Brighton. Where are your parents from? I'm English. I'm like, you're not English. Where are your parents from? Africa. That's what Nigeria.
When they say Africa, you know, they're still not wanting to relate.
But her mannerisms were funny, so we kind of bonded. You know, I don't know how I get on with these young people. I don't know. I always pray to God before I see people, to God to guide me. So I saw her, we talked about medication. I said, I'm not going to force you to do anything, but I want you to just consider this, and I'll see you in 2 weeks' time. Try this for me, right? She said, okay. She came back. She was like, oh, this, that. You know? She dabbled in the odd cannabis. Is what she said the first time. Found out she was doing it regularly. And I put her on this mood stabilizer. I gave her something to help her sleep. Right? Then, I saw her in January. I saw her in February. And I went home. Last March, before that. I went home because of my dad. So, whilst I was there, I was working remotely. I got an email that she had called to say she had run out of medication. I was like, can she run out of medication? I said, check exactly what happened to her medication. She said she lost her medication. I said, okay, give her a week's worth, right? I'll be back next week. Give her a week's worth of medication and tell her I want to see her. I got back on a Monday, so I was at work on Tuesday. I went to see her on Tuesday. So she came to my clinic. So I just first started, like, also what's happening, and it seemed like she dressed up for me. You know? She had this, let's not forget it, she was just odd. And then I said, what happened? Tell me honestly what happened to your medication. Because I was thinking, hope she didn't take an overdose. She now said, oh, that what really happened, her dad threw her medication away. I said, your dad? She said, yes, you know, that he came in, he saw the tablets in her pocket and asked her what this in her jacket pocket. What are these? And she said, oh, the doctor prescribed it for my mood. And he said, what rubbish. We don't have mental health
in our family.
And he took her medication, obviously when they threw the medication away, and that's what happened. So because we had built up a rapport, she didn't want to let me down by not taking the medication. So we did all this pinky swear, like punch, chop knuckle kind of thing, you know. So I said, so what are you doing for Easter, you know? I said, oh, that probably going to go to Lagos, this, that. I said, really? She said, yeah. I said, your dad isn't coming. She said, no, dad likes us to come down, you know, he does a lot of work for the government, you know. Then she now said something. The expression on her face triggered something in my brain. So I said, okay, you go have fun, you know, see so. Chichi. And she walked out of my office. I just picked up my Facebook. Went to Facebook. I went to her father's account with my guy. From KC, Unilag, my guy. We used to hang out together in those days. You two get going. So, I said it's a lie. Because I don't know, because the surname, I said, I've seen this girl before. And I went to his Facebook. But then he had old pictures, and I went to his Instagram. He's my Instagram friend as well. And there she was.
Wow.
My friend's daughter. And when she left, before she left, I said, when you go or when you see your dad, tell him that the doctor that is teaching you is Nigerian. Yeah? That she's Nigerian. And give him my name and tell him that if he wants to speak to me
about this whole thing.
My patients know me as Dr. Penberton-Mola or Dr. Pemberton. A few of them try to ask what's my first name. None of your business. I'm a doctor, don't call me by my first name. So I spelled my name out to her because all my letters that she would get a copy of, just all my letters have N. Pemberton. Yeah? So I said, this is my full name. Give it to your dad. So this was March. Then when I realized that she was my friend's daughter, I now had to inform management that I can't. So she now came I went for my dad's thing, came back in May. And I came out to the reception and there she was. She saw me, she turned her head away, like she didn't see me. So I now figured that she must have told her dad. And dad have said, Nkechi?
You want
do you understand?
Yeah. Make sure you cut all any.
Don't say anything.
Yeah.
I'm sure she told her dad. I told her I know that woman. You know.
Don't come and let her know what's going on in her house.
Well, I already knew.
Yeah.
But the good thing for me, it didn't matter that. And it didn't matter if she told her dad or not.
At least, yeah.
The thing is, I saw her in clinic, so at least she was still trying to keep up with doing what she was meant to be doing.
But you see, this is what we're talking about this stigmatized because of whatever shame or whatever the dad was feeling.
This is ignorance.
It's ignorance.
Yeah.
I would want to. I know you can't share. Obviously, if my daughter came to you, I know you'd be able to tell me about her. But I would, as a parent, I would even try.
Yeah.
I reach out to you. You will then tell me, Chinaz, I can't share this with you. Yeah. But I would reach out to you or even thank you for even, you know what I mean? Mm-hmm. So it's this destigmatization that we have an issue with.
So guess what? I had an impression that she had borderline personality disorder, right? Because she had both issues and emotional issues. That's why I put her on the stabilizer first of all. And I also suspected that she might have some neurodivergence. So autism, ADHD. Her mannerisms were like, you know, and very poor eye contact. She didn't have a lot of friends. And there's something about ADHD and using cannabis or cocaine.
Okay.
There's something about that. And the thing is, a lot of guys would use drugs. But girls, because of their emotional parts, will end up like self-harming or throwing tantrums. And then later on, they now diagnose them in adulthood with ADHD, adult ADHD or ASD, you know? Of course, you know ASD, that's another zone. It's a huge spectrum from here to there. You know? So but I had this impression of neurodivergence, you know, and some borderline things. She might be gay. You know? That's
also another, struggling to,
So I now spoke to the doctor who started seeing her, you know, and I said to her, refer her for an assessment, you know, just refer her to the neurodivergent service and just say that she has traits suggestive of this and this.
And see what they... So our churches and mosques and community lead parents, I don't even know, this mental health thing is plenty.
It's huge.
It's really plenty. I just wish more people would reach out and try and get help. When you feel that something is going on, try and get help. Because I feel like our generation, a lot of us are going to be very miserable as our children flee the nest, and we're now left alone to deal with ourselves. Because you know when you have children, you're busy.
That's when a lot of couples now break up.
Yeah.
Because the thing that's kept them together,
it's gone. The empty nesters, they now,
So they've been co-parenting and forgotten that they were meant to be a couple in the first place. You know, and then the woman is going through menopause. The guy is feeling like, this man don't old for me. She's not doing it for me anymore. He's going through his own changes as well. But no one is talking to anybody.
And that's it. And lastly, therapy. So therapy is I'm trying. So one of my friends, I asked her if she knew a black therapist. She said she knows somebody who's a life coach.
I know a couple of amazing life coaches.
Are they black people?
They're Blue Sisters.
Really?
Oh my gosh, these women. We did a reunion last year. Went to Istanbul, and we had different talks. We had the doctors doing their own talks. We had a financial QC. Up school. Man, we have some solid.
They will soon finish us. They will say where. So because I feel like those kind of things will all help people.
We had this coaching session. I left Istanbul
buzzing.
Ideas what to do. So I'll give you the details later. You know? And maybe it might be interesting if you could have a conversation with one of them, two of them. So one of them is she lives in Switzerland. She's actually a pastor's wife. You know, and the other one lives here. She's in Orpington. You know, she is amazing. Well, I knew her from primary school. So we're in primary school, secondary school. You know, she's amazing. She's done something with, you know, she's done a lot with a lot of our classmates. You know, who have paid her, and almost like forced her to take the money. Because she can't be charging us, but she charges people. She's amazing.
So, but life coaches are very different from therapists, right?
Yeah, but
are they linked?
They're linked. There's this thing called the DISC assessment.
Okay.
Right. So they use it. It's almost like trying to figure out your personality. You know, and that would inform a lot of things. why you do certain things, identify lots of things, you know. So I want to do my own disc assessment, or disc analysis, what she call it again, you know. So when she first said, I just signed somebody I knew very close to me. I signed up immediately, you know, and they finished their sessions, and that one is even the way she even talks, you know, it's different from how she spoke before. She speaks with more confidence and more certainty about what she knows, what she's saying. You know, we had a fallout one time, and she sent me a message, tell me that what I did was out of order. I was like, ooh, go. You understand? So I think it's very
So these are the things, because these are, I mean, I know we're digressing, but these are all the things
that we're not digressing, we're talking about therapy.
Exactly. But these are all the things that we can do to help us keep our mental state, preserve our mental state, because we're going through so much. And first of all, I think COVID knocked many of us. I don't know about you. COVID knocked many people, including myself. So I think people are now still struggling. I'm still struggling.
A lot of things actually happened during the COVID.
Yeah.
Lots of mental health difficulties developed during COVID.
Yes.
Like eating issues. I worked in eating disorders. I've been everywhere. I worked in eating disorders. People that went on this weight loss thing and it now became something in their heads, you know. Another thing that we do in our country that people don't understand the implications of their words. Words are very, very powerful.
Yeah.
So we have people who would see you and go, Chinazo, you have gained though. Say that to a young
impressionable, they will take,
they now want to do everything they can not to get that comment anymore. You know, even us as strong and resilient as we are, it pisses us off.
Of course, it will affect you, because you can clap back, but you sure know that you're going to think about it later. We are clap back first of all.
So you can imagine what it does to our kids. You know, we're very judgmental people. Niger people. We can point finger.
Niger people. I'm going to get my friend who's not Nigerian. We're going to have a talk, and I just want, but she knows a lot of Nigerian. She hangs with us. I want her, you know, it's good to have an outsider's. Sometimes when I tell her things, she's like, the things you people say, because we just say things.
I met this patient today, very lovely young boy from South Africa. Extremely paranoid and so deluded, it's unbelievable. He told me some amazing things, his superpowers, his conversations with God, how he saved Donald Trump from the sniper that tried to assassinate him last year. His hit list, he has Joe Biden as one of his things, and he's dealt with him because he got him out of office. The next person on his list is Rupert
Murdoch. Oh Lord.
Yeah. So he's going to use his cosmic powers to get that guy sorted out, because that's one of his problems. The guy is the main problem. So he's so deluded, it's unbelievable, but such a beautiful soul. So he was like, he was running South African, a face card South African. I said, oh, come on, brother, you know, I thought he was white South African. And then he was like, where are you from? I said, where do you think? I said, from the giant of Africa. He said, you're Niger?
Oh, really?
Oh, I felt so proud. You know? He was like,
Nigerians are special. No, it's good to. People. I'm gonna have somebody. I have because my friend, she's been dodging, but I will bring her in just to laugh about Nigerians, because we're really special. Yeah. But in that being special, we have a lot of deep-rooted issues and beliefs that we don't even want to shake off, even the ones that are out here.
Yeah, I'll tell you what we did during COVID. So this life coach that I told you about, the one that lives here, she's almost like our class captain. You know, she organizes everything. She's so amazing. So we used to have these Zoom calls, just checking on it. And that became a thing, you know. So one of the talks we had, I don't know how we started talking about it, and then someone talked about how she was traumatized at a young age when she saw a big uncles or something. He exposed himself in front of her. And then that's how people started sharing a lot of things that happened to them.
People are carrying a lot.
So they carried all these things all through secondary school. You know, sexual abuse. Amazing. lot of our sisters.
Of course.
Talked about what they went through, you know? And I was just amazed. I was very touched by, it was a safe place.
Yes.
You know? And I think us women, we need to be more open with each other, and more honest with each other.
And nicer to each other. We need to be nicer about and to each other, because women can be very mean.
But you know what the men folk do not want? They don't want women to unify.
Yeah.
Because they know how powerful we are.
Yeah, together.
Sorry,
yeah.
guys. But they know that when women come together,
yeah.
you cannot shake them, you know? But that's their work over the years. Go and check it, generation to generation. I always ask people, in the Bible, have you ever come across an adulterous man? It's a woman who's an adulteress. Solomon.
With all the plenty. Concubines.
Drinking from your morning dew. Now life in it. You know? Drinking from your bosom. David, with the voice of God, killed his friend just because he wanted to chop his friend's life. Do you understand? And they make him look like a correct guy. A woman steps out on a marriage. It's a horrible thing. A man does it, it's a man that is a woman's fault.
Of course, it'll always be your fault.
So women, if we need to start understanding what our power is, and I always tell girls, I know we're digressing again.
Well, it's my podcast, so we can digress if you want.
Right? I use this analogy of, I use the head and the neck. If you put the head on the shoulders, can it turn left or right? So this one, the neck, will move the head wherever you want to go.
True.
But the head you think is one that's turning the neck.
That's the kidney.
It's okay. We need to understand that power. And let's unite, girls. We need to unite.
Girls need to.
I love my sisters. You know? Of course, we have our scoring, but we're still together.
We're still together.
We just need to keep spreading our thing.
It's good. And it's good that you guys, you have that place where you could share. And it's from sharing that we can even destigmatize, to be honest, because if people stopped hiding what was going on, then more people would see that, this thing is not just in my house. So
me too.
Yeah, me too. And then it would. So that's also another way.
How do you stop the next generation from
yeah.
What can you do different?
Absolutely.
Yeah.
Absolutely. Hi, Nkechi. Thank you so much for coming all the way after work to this place for us.
I don't want to keep seeing you in my dream. When are we doing this thing?
You know what? I decided. You know why? I procrastinated a lot, and now I've had this light bulb moment since last year, which is how this whole podcast even started.
I remember when we first mentioned it, I was like, why not? And here we are.
So now I'm hounding people. I'm like, let me just get people in, because people are very conservative. People don't want to talk. People don't want to share. But it's not. That's why it's not scripted, because I don't want it to be very serious and very deep, and everybody has to prepare, and then people run away. So, thank you so much. I love you.
I love you too, girl.
And I have one Odala. I'll give you one Odala. Okay, what do you want? Icheku. I'll give you Icheku to take away.
You know that this is my friend I was telling you about, the one that knows everything about it. Came back from Nigeria. He brought that Cotonou.
That's the sweetest.
Yeah.
That's the sweetest.
Man, I kept this thing, and in front of me.
What happened? How can you allow Udala? That's an abomination.
Okay, let me not say it went off. I think what happened was, because I like my Udala to be fresh. If the color is not the same,
we don't. Fresh. Yeah, you're fresh.
So in my head,
it was still good. It was still good.
But I just thought, I can't give this to anybody, because I can't.
Why didn't you tell me? I would have come to collect it.
You would have come all the way to Kent.
I would have come. Me that I went to do. I went to Hello.
People are looking for you. People are looking for you. You'll be oppressing people online.
I'll give you Cheku, because I have some. I'll give you some.
Hey.
So guys, I know we're gisting. We've forgotten you guys are here. So.
If you have any questions, specific questions, you can send them to Chichi.
Yes.
And if she sends them to me, I can answer them. You don't need to give details about yourself. You can send the messages or questions anonymously, and I'll do what I can to answer your questions. You
see, you're amazing. Guys, so you guys heard now. If you have any mental health questions, could be about you, somebody that you know, your child, reach out. Just let me know. You don't have to even tell me. Just say, can I have Nkechi's Instagram? Are you on Instagram or Facebook?
I'm on Instagram. I'm on Facebook.
Anyway, let me know and I'll connect you guys.
Yeah.
I'll connect you guys. This mental health is not something we can finish talking about in...
Hey, why don't we do it this way, Nazo? Why don't you open a Facebook account, right? And people can direct the questions directly to that.
Nazar Circles has a Facebook page. So they can, So guys, if you want, so if you
can send messages to your
Facebook. They should be able to.
Instagram. Can they DM you on Instagram?
Yeah. I'm on Instagram. They know. This there. If you this is your first time, then you don't know. But if this is not your first time, you would know. It's at Nazar Circus on Facebook, on Instagram. If you know me personally, of course, WhatsApp me. Many people will WhatsApp me, but they will not want to come on here to talk.
Yeah.
So
please DM her.
Yes.
Any questions you have.
This whole mental health thing, Nkechi, and I think it's important that you were saying about talking to your friend who is a pastor. These are things
I'm going to talk to him.
If we normalize talking about these issues, then it will not be a taboo. That's the only way to conquer stigmas and taboos.
Yeah.
Normalizing conversations around it, then it will now not be a big thing.
Yeah.
I think that's the only way we can do, and that's in, like you said, in churches. Everybody goes to, most people, not everybody, most people go to church or mosques, whatever. If we normalize it, then it won't be a stigma.
Exactly. But there's another thing I have come across in recent years. People pathologize everything now, right? They make excuses for everything. There was something that happened recently. I think this guy threw a tantrum. Was he hitting his dad or his uncle somewhere? I can't remember what it was. And they was like, the guy has mental health issues. I said, no, that's bad behavior. Yeah. You know? So don't pathologize everything. Don't make everything, because he has this. No. Yeah. People should learn to take accountability, take responsibility for what they have done. And
then you can now, So just generalizing that, it's mental. It's mental. You're right.
Yeah.
You're right.
That as well. So there's the flip side of people overdiagnosing bad behavior and giving it mental health.
True.
You know? And that's why you're a lawyer. You see people who want to come and pretend that they did something because they were not in the right sense. Yeah, when they were just behaving responsible. Yeah, they were just when I worked in the forensic service, there was this Nigerian boy that left a hammer. I'll show you the pictures later on. He left a hammer. He's on the internet. He's not. He left a claw. That claw hammer in his. So he was in this accommodation they'll give people. So a housemate. So the guy moved in that day, and he didn't like the fact that the guy was gay. So because he's coming from a Nigerian religious background.
So homophobia at the highest level.
Yes. He went into this guy's room while the guy was asleep and just planted the claw hammer at this guy's skull. The guy survived. And then he was when I went outside and said, this is what he did. So when I met him, he had been there this was in September of 2023. So the consultant called me and said, could you have a conversation with this boy? Because you're Nigerian. And there's sometimes the guy seems to be responding to unseen stimuli, i.e. is responding to his auditory hallucinations, and he's speaking a different language. Okay. That was what he just pretended, He was trying to give the impression that he was not okay. Not well. So so he was sentenced. No. He was still facing, what do you call that? I don't know.
He was in remand or something.
He was remanded, yes. So because of his mental state,
they had to be in that place.
For the assessment and treatment, if any, of any mental health issues. So
he's trying to play the system.
This guy, I said,
please.
Nothing wrong with him.
He's homophobic.
Yeah, the same simple. This Nigerian woman. I was working in a Basildon at the time.
The guy will say, "Oh my God, this my sister she has seen me finish."
That is it. So this other one, Igbo woman. There's a deportation center. That holding place. She came from there. They put her in the medium secure forensic unit, and then I just started working there. So I came down to the ward because I usually like to parley with nurses because they spend most time with the patients. You can get so much information from them. So I was there chatting with them. So I just sat on the table. They have this glass hanging around the nursing station. And then this woman came, made up everything, wig and all that. I started speaking Igbo. So me go back to Nigeria. She was
speaking Igbo out. She's speaking out in Igbo.
She was saying what she said. I was like, am I hearing what I'm hearing?
Yeah.
And she was going on, talking. I was like, what's going on? So that's what she does,
They didn't know she was actually making sense, just talking.
She was and responding.
Oh yes, yes.
So she's having a proper conversation.
But didn't know she was talking normally. What she was saying was.
So now laid close to the window because there was this gap where they could pass things. I said, Eziokwu.
Are you serious?
She just thought, hey, one name why? Hey, Biko. I said, Biko what? Today.
You're going.
And the people like you that come and give us a badge.
Yeah.
So the people who know how to, who try to
play. Yeah. So that's also the.
Yes.
Yeah. Oh.
She didn't want to be deported. She was trying to now seek asylum and say that because she was mentally unwell, that she was afraid that.
But the mentally unwell was talking happily in her language.
In language, say, I got so many moved your wife to Nigeria. God forbid.
Your weekend. Listen, I've had so much fun. We've been talking and talking. I'm sure you're talked out. I'm sure, guys, we're going to round up now. Thank you so much for listening. Like I said, if you have any questions or issues or you want Nkechi to assist you, send me a message at Nazar Circles, Facebook, Instagram. Yes, and she will be happy to assist you.
Yeah, advise you, because I'm not going to treat you. I'm not going to prescribe anything for you. I'm just going to advise you
and signpost and whatever you can do to help. Yeah. Guys, thank you so much. So comment, share, because you just don't know who this can help. I know that we've been rambling on, but that's what we do. And I hope don't apologize. That's what we do, and I hope this helps somebody. So until next time, I'm sending you guys peace, love, take care, and stay safe out there. Nkechi, do you want to say bye? Yes. Bye, everybody.
Bye.